The Committee on Homeland Security of the U.S. House of Representatives held a hearing titled Confronting the Coronavirus, Perspectives on the Response to a Pandemic Threat on March 4, 2020, a full 7 days before the World Health Organization declared COVID-19 a pandemic on March 11th. Testifying before the committee was Dr. Ngozi Ezike, Director of the Illinois Department of Public Health. Dr. Ezike has proven herself to be a near total puppet for the CDC's agenda. It comes as no surprise that Illinois was chosen by the CDC to be the very first state to provide testing for COVID-19, and that Illinois has conducted more tests for COVID-19 than any other state. As you will see, the CDC has been preparing Dr. Ezike, IDPH, and local health departments in Illinois for this exact scenario for over a year. Also testifying was Dr. Tom Inglesby, Director of the Center for Health Security at Johns Hopkins University. In 2019, the Center for Health Security held a tabletop exercise which simulated an outbreak of a novel coronavirus transmitted from bats to pigs to people that eventually became very transmissible from person to person, leading to a severe global pandemic. The pathogen and the disease it caused were modeled largely on severe acute respiratory syndrome, or SARS. The final witness was Dr. Julie Gerberding, the former director of CDC, former president of Merck's vaccine division, and the current executive vice president and chief patient officer for strategic communication, global public policy, and population health. Let's listen to an excerpt of Dr. Ezike's testimony regarding the tabletop exercise that the state of Illinois participated in, also in 2019, called Crimson Contagion, which involved an influenza pandemic originating in China. The timing of these two tabletop exercises is very suggestive of a level of pre-knowledge of the COVID-19 pandemic, which has had dramatic effects for nearly everyone on the planet, and is an attempt to usher in a global surveillance society with dystopian government restrictions.
In your testimony, you wrote that Illinois conducted an exercise last year, the Crimson Contagion. Can you tell us more about those kinds of exercises and why they're such an important part of your preparation to respond to potential outbreaks?
So in the aftermath of 9/11, we started getting funding for what our office is called the Office of Preparedness and Response. And so in that office, it's gearing up, as the doctor mentioned, trying to prepare for what are the eventual situations that can arise. And so tabletop exercises where you convene with the federal government, multiple states, local health departments, businesses, schools, communities, all, we had a almost week-long exercise where the event which was created was a novel virus that came from China and was spreading throughout the world. So that was the scenario that was played out with all these partners at the table. And so thinking through the what ifs, if you will, is part of the preparedness. And so the more prepared you are, then when you see something similar to that, then you switch into response.
Sure.
As you just heard, one of the main reasons these exercises take place without much, if any, public awareness is so the people in government and healthcare organizations are ready and able to respond and continue to function while the general public is caught wholly unprepared, is paralyzed by fear, and eagerly awaits instruction from authorities. Do not allow yourself to be controlled by fear. Be brave, be informed, be independent, and reject and defy the oppression and the oppressors at every opportunity.